Hi, this is Jean Henningsen with Monarch Leadership Group, and this is Leading Through Crisis, Making a Difference. And here with me today is Joe Johnson. He is the President and CEO of Advent Health. Thank you so much for being here, Joe.
What a pleasure, Jean. Thank you for inviting me.
Yes, absolutely. And I need to let everyone know that you very graciously spent a good 30 minutes with me 2 weeks ago, I think it was. And I didn't realize that I was not recording the video. So I want everyone to know that, because this is a healthcare crisis and you are a leader of one of the biggest healthcare establishments that we have here in Ocala. So I think it's important they know that you did make the time for me, and I so do appreciate your making the time yet again. So please tell us, because everybody wants to know, what has the hospital done in response to this crisis? And when did you all start, and how is everything now?
Well, first of all, let me just assure you that you're not the first one to encounter technical difficulties. If that were the case, I might have something to complain about. But no, I'm grateful for the second opportunity to speak with you, and this will still be the first time many people see it. So
Sure.
It's just great. So yeah, this has been an interesting few months. We've been in town as Advent Health for just over a year and a half, and I think from the very beginning, since we got here, it's been my statement, and it's been a little awkward at times, but we were a broken hospital. We had a lot of things to work on: safety, quality, patient experience, just community engagement. So over the last year and a half, we've been working hard to try and improve those measures, those metrics, and we started really getting some traction. Last fall, we were thankful to be able to go from a D rating to a B rating, which put us right there with the top performers in the community from a safety standpoint. A lot of things started moving in the right direction, turning in ways that we had hoped. This is a multi-year cultural process that we're engaged in.
Sure.
So then came COVID-19.
Wow.
And it was like pushing this big reset button. Everything kind of went back to a very different time and process. But back in the late December, we started hearing about China and how this strange virus was affecting the population there. Another month, another 2 months, and we started seeing more and more cases in the U.S. and even some deaths. And by the middle of March, the governor was sending executive letters out saying we've got to stop doing elective procedures at the hospitals. We've got to do social distancing. We're shutting down schools, blah, blah, blah. I mean, it was rapid fire. And this during that early time of planning and preparing for this pandemic, our team got together and really started focusing in on what do we have to do to prepare for what was predicted to be an overwhelming surge of patients that were coming through. Mm-hmm. So this was also a time when the state held daily calls with the state secretary for ACA, as well as the Surgeon General for the state. They would have daily calls, and we would call in and get information, guidance. We were hearing from the CDC. We were hearing from our own corporation and our own division, getting a lot of information that was funneling into us. And then we were trying to make sense of all those inputs to make sure that we were getting information back out to the right publics in a way that was meaningful and not overwhelming to everybody else. So that was an interesting time, but it was it was encouraging to have a strong team around to be able to activate on plans and create new policies literally on the fly. We had to re-engineer our entrances and what where we were taking care of certain types of patients. We had to move things to a large degree. It was exciting, energizing, and terribly tiring as well. The days were long. The weeks seemed to never end, and we would spend significant amount of time here in the hospital just to make sure that our team had what they needed in terms of PPE, personal protective equipment, that our patients were assured of their safety. And in the early days, we weren't knowing what we would have down the line in terms of test kits and PPE availability. So we had to be a little stingy at the beginning. And to preserve that PPE was very important to us as we watched what was happening in New York and Italy and different places in large populations where the spread was just on the news every night, all day. And it was terribly concerning to our employees and our patients and our medical staff. A lot of fear, truly. But as we watched for the guidance of the CDC, we just stayed right on track and stayed on message as to what we needed to do, what we needed to have in place. And, over time, people kind of got to a level of appreciation for that kind of level of guidance. So a lot of things happening, Jean, a lot of fun things.
Yes, I know you've been through a lot, and you all started early. I think you remember you told me January that you all really started to take action at the hospital. And I think a lot of us still were pretty clueless in January. And none of us really started taking it serious until, like you said, the governor started saying, okay, we have to stop this, we have to stop this. So you all have been working incredible hours, 7 days a week, you mentioned before, and because this is a healthcare crisis and you're working in a hospital, I imagine the stress, the anxiety, the uncertainty must have been pretty significant with your employees. So talk me through, how did you and your leadership team help those employees and yourselves with these kinds of emotions?
So, our one of our main themes at Advent Health is to help people be whole, to help them have balanced lives and to be everything they could be. And as we started looking into this concept of what might this do to our employees and our physicians and our own team members, what would this look like? So we had to take action quick. And our corporation, being a not-for-profit, being a faith-based organization, took a very specific stand on keeping our employees whole, not laying off, not furloughing, not asking them to take pay cuts. For a period of 60 days during the crisis time, we needed our team to be here. We needed them to be whole from a financial standpoint and other ways too. We wanted to make sure that we had them ready to go when ultimately we started opening up again. We wanted to make sure our team was in place. But in spite of the financial wholeness, we also recognized that schools were closed. So, families now had students at home, young children, family members that needed to be taken care of. So there were spouses that were involved, and now we're having staff coming home that are scared about bringing something to their family that could be contagious.
Right.
And so there were a lot of things in motion here where we were really trying to make sure that keeping people whole was not just a financial issue. So we wanted to make sure that we had plenty of information, but access to EAP. We wanted to make sure that we had access for child care services. And for those who might be nervous about going home with, carrying some disease on themselves, we actually contracted with hotels to be able to have employees access those spaces in order to not take care of or take something home. Very few took us up on that, but we wanted to make sure that was in place, and it was something we were appreciative of having.
Wonderful. Great. So what is it like now at the hospital? What is the stress level like, the anxiety of your employees?
So it's interesting. Everything that we worked to do was to get back into normal. What we want as humans, as we are with organizations, we want normal. And so as we started recognizing that this actually would come to an end, this crisis aspect there would be an end point. And we started thinking through, okay, now how do we do this safely? How do we do it appropriately? And we want to make sure that we're, connecting with the community to assure them, give them confidence that we have, proper procedures in place, that we have the precautions for their safety. But we also want to make sure that our team is safe and our medical staff and all of our processes are in place. So, everything we've done is to prepare to get back to normal. Now, as we've started back into doing elective procedures and allowing more visitors into the building, that process does have its own level of stress, like you mentioned. And so now it's trying to keep up with a good pace of growth and reacclimatizing ourselves to that volume increase. And that's, by all means, we're not normal yet. We're not back to a level that is normal. But in some areas, it feels still a little stressful because the elements that we have to go through tend to make the work more challenging, to be able to accommodate even that lower but growing level of business that's coming back to the hospital. So nobody's complaining. We're all grateful for that kind of challenge, but it does have a little bit of stress to it. And
Sure.
I'm grateful that folks at this point are in place. They don't have to engage in the environment because for the most part they've been here, except for those few that were allowed and able to work from home. Those by and large are still working from home.
Okay.
And that's great because we don't have to expose anybody to anything that they don't need to be exposed to, and it preserves PPE, quite honestly.
Yes. Yes.
It's a good process.
Yeah, wonderful. Well, that sounds great. And I'm going to ask you more about this phasing back in and the reopening. But I want to ask you first, if you were to look back, since January, you've really been dealing with this. So a lot longer than a lot of other businesses. If you were to look back at everything that's happened since January and all of the changes that you've been through and all of the many decisions, like you said, you've had to rethink so much of your processes and just doing things completely differently. What do you think as a leader would be like your top 2 or 3 leadership skills that you really believe you needed to tap into during this time in order to effectively lead through this crisis?
Well, first and very foremost, you have to have a team around you that can help lift all the many aspects of the planning and the execution the communication. So you have to have a team that you have trust in. And fortunately, I am blessed with an executive team around me that I trust implicitly. I gathered them together at least once a day, and we would walk our way through an incident command type grid, looking at what tasks needed to be done. So breaking down the large amount of things into categories that fit with the incident command process was another major important feature of dealing with the crisis. And so having those leaders daily connect and make sure that we were walking through what tasks, and then looking at logistics, looking at HR issues, looking at the clinical type issues, and whatever other process type things needed to be done. It was a daily exercise that we were closing the loop on yesterday and talking about what we needed to have in place for tomorrow or even today. And that helped us really define and move our way through just an innumerable number of things that had to be done. Having an executive team that they didn't look at the clock, they looked at what needed to be done. They rounded a lot on their teams because the communication was so rapid, and so they were seeing information from so many different sources. It was confusing to a lot of people. It was scary. And so giving that face time, getting out there to the troops, if you will, was so important to be able to answer questions and deal with issues as they were coming up. Trying to have a connection through virtual meetings was also something we had to learn. So having the IT connectivity and having them on board virtually every time we turned on the camera was really important, because we were learning too, and still are learning, honestly, but we're coming to a lot more peace with it. It's a new set of skills that we're all having to learn. So being flexible, being ready to try new and different things is also a skill that we've been engaging in.
Yeah, especially since things were changing in the beginning, sometimes hourly and certainly daily. And like you said, meeting with your team every week. I have spoke to a lot of leaders that did something similar, meeting on a regular basis, because you have to constantly be taking in the information, right? All the directives that we were being given on what we can do and what we can't do, and then integrating that. Okay, so what does that mean for our organization? And what does that look like?
Right.
So yeah, that was definitely a challenging time. And now, like you said, it's kind of a different challenge, because now we're looked at, all right, now how do we reintegrate and phase back in? So connection, flexibility, yes, I can see how those would have been really critical, especially at the hospital.
Yeah, and it's again a blessing to be a part of a corporation that is faith-based, because we had a lot of resources available to us, especially as we went through Easter, and we had a full week of inspiration and prayers that we shared with our team. We were able to participate in that. It was meaningful. It was timely. It was kind of foundational to who we are, and gave us a lot of faith to fall back on. So that was another really important aspect that I think we appreciated very much. Our chaplains rounded, constantly through our teams, making sure that we were listening and hearing and participating. I got to tell you, one of the most inspirational things that we did was when we got to discharge. We got to send our first COVID positive patient home. And I tell you, it was it's a piece that went viral. Actually, we had close to a million hits on the thing, which is just phenomenal. But a patient leaving our facility to hallways just lined with employees applauding. It was heartwarming and very inspirational for our team to be able to do that.
Yes, no, absolutely. And I'm glad that you were able to provide that hope. And like you said, that foundation and grounding during such an uncertain time as this. So tell us, Joe, as we are phasing back in now slowly and now being more social, even though we're being told to remain distant from each other, what do you want people in Ocala to know, to hear as we start phasing back in? What do you think it's important for us to know?
You know, as we've been hearing from the governor and from other folks, we're reopening the economy. We're getting back into, I hope, a new level of normal that's closer to the old normal. But even as we gradually open up elements of our economy and society, what I don't want people to think is that it's over, that COVID-19 is gone, and that's not the case. It is still here. It is flaring up in different places, maybe in the world, in different parts of the country, and it may very well come back time and again. So this is not gone, but it is, fortunately, and we're very blessed here in Marion County to have a very, very low incidence rate of COVID-19. And I'm just so thrilled that we're in a county that is taking precautions. There are probably certain benefits of having what we have here because it seems like we may be naturally socially distancing to a degree. That's a good thing. Because to beat this, I think, is going to take ultimately a vaccination, known therapies to treat this program, and we just don't have those yet. In the meantime, we're going to have to be socially distancing, wash our hands continuously. We're going to have to do a lot more virtually. And honestly, when you're out and about in stores or large gatherings, wearing masks. And I think what I would really stress to any listener is that wearing a mask is not necessarily protecting me. What wearing a mask is, I wear a mask to protect you. It's a courtesy thing. And as we learn how to be courteous in this new environment, this new normal, I think we will come to a place where we're doing this for each other. It is not to protect me from you, because honestly, we don't know enough about how this droplet gets into potentially your eyes or other ways. But just wearing an N95 mask is not the end and be all of protection. It's very important in a clinical setting where you're gowned up and treating a patient that may have COVID-19. But in a grocery store, wearing an N95 isn't going to be the protection, and people may have a false sense of security.
Yes.
That it's protecting themselves. Or even if they wear gloves and an N95 while they're grocery shopping, that's probably not that necessary. But what it does is protects you from me, and it's a courtesy thing. So wash hands and do your best to keep socially distant. I think that's the right thing at this time. But in the meantime, nobody needs to panic. It's still there. Fortunately, in our county, it's very low incidence rate, and we're grateful for that.
Yeah, so absolutely. It definitely could have been much worse, and you all were prepared for that, which I'm grateful that your hospital did take such measures so that you were ready and in case it wasn't, but I'm glad we didn't need that. And thank you for all that you said about what we should and shouldn't be doing right now, because I think there is a lot of confusion still. I see people driving by themselves in a car with a mask on. And I think, who are they protecting by wearing their mask? You know, it's confusion, but the fear is what makes them drive with their mask on, even though they're by themselves. So thank you for that clarification. And just so everybody knows, watching this, this was recorded on May 28th. So we are still social distancing, the end of May. We're still under stay-at-home orders. You know, a lot of people think because the restaurants, you know, are at 50% capacity or whatever we are now, that it means, okay, we're fine and it's over.
Right.
So I'm glad that you, the head of our hospital, is saying, no, it's not over.
Right. And everybody, believe me, I'm wanting to get out there and have life as normal. Believe me, everybody is looking forward to that. But we just have to do it safely and thoughtfully, and watch for the official guidance to allow us to do it appropriately. And again, it's not about what I believe or don't believe. I've seen and heard it all. It's about what can I do to make sure that I'm protecting you and being courteous to those around me.
Yes, absolutely. Well, I cannot thank you enough for your leadership through this crisis and this time of uncertainty. Obviously, it's invaluable to our community and to all of your staff. I love seeing the signs around town, you know, thanking the nurses and the doctors and everyone at your hospital who has been putting themselves at risk in order to protect the rest of us. So thank you so much for all that you're doing now and that you continue to do for our community, Joe. It's so appreciated.
Well, what a pleasure, Jean. And I got to tell you, it is a thrill and a joy to be a part of this community. And I know our team has felt the love from this community, the outpouring, the generosity, the food, the prayers, the vigils. It has been so amazing to me, but to our team, to see that kind of support from the community is powerful. So thank you.
Oh, that's awesome. I'm glad they feel the love, because it's certainly there.
Yeah, definitely feel the love.
Well, thank you so much for your time. I really appreciate it, Joe.
Well, thank you for the opportunity, Jean. Appreciate it very much. Stay healthy.
Absolutely. You too.